Welcome to another episode of Respections. I'm your host, Patrick Tomlinson, and today we have with us a very interesting guest, Roberta Todd. Roberta is a retired project manager who is vice president of the N.W Bronx Community and Clergy Coalition. In addition, she's a cradle Episcopalian who is a member of the Episcopal Diocese of New York's Social Concern Commission and active in anti-racism and advocacy and action committees. She's also a member of the Union of Black Episcopalians New York chapter and coordinates the social justice ministry at her congregation, Christ Church in Riverdale in the Bronx. Her career in corporate America spanned more than 40 years, beginning as a banker with Chase Manhattan Bank, as an accounting supervisor and analyst. She has also worked with Exxon Corporation and as a project manager at Ernst & Young. She retired from the corporate life in 2015, and now she is active in many social issues across the Bronx. She's a native New Yorker who started life in Queens, was educated in the public school systems here in Brooklyn, New York, and graduated from Wheaton College in Norton, Massachusetts. She did her MBA at the famous Wharton School at the University of Pennsylvania. Roberta has lived in the Bronx since 1999, and to relax, she knits and crochets, and is a regular practitioner of yoga and Tai Chi. She's an avid reader, a member of the Harlem Literary Society, and she has traveled extensively throughout Asia, Africa, and Latin America with her husband and partner for 35 years. Welcome, Roberta.
Thank you. Thank you so much for that introduction. And I'm so glad to be here to share some of the things that are happening in the Bronx. But before I do that, I think it's important that people know how I even became so active in advocacy. When I retired, I realized that I was not ready to just lay down or look at TV all day, but I was still very active. So I was discussing that with my deacon at my church, that is Deacon Ella Roundtree, and she suggested that I do a course on Encore Transition, which is in Union Theology. And that's a course where it says for older people to learn what they can do to help make and address conditions that can transform the world and our culture into a more just and equitable society. So that's how come I'm here. And Patrick did share some of the activities that I'm engaged in, and I want to just share on this slide so you can see them. And I'm going to share a little bit of what I've done in those activities.
But before you get into that, Rob, Can you tell us a little bit of your early life, some of the people who influenced you, how you grew up and where you know.
Okay,
yes.
So I shared with you that Brooklyn was my, I guess my stomping grounds. And my teachers, I went to, where I went to junior high school, I can remember my home ed teacher was Irma Boyce, who I've always, will never forget her because she was one of the few black teachers in that school. And the principal of that school, if I remember, was Principal Rutledge. And she also, they were very influential. And this is in my junior high. And then from there, I went to Thomas Jefferson, and I was in a college discovery program, and that just kind of set my path or made sure that my path was correct in terms of attending college and improving my life.
Very good, very good. And from there, you moved on to college, as your bio says.
Yes.
And you got?
So based on going to college, actually, I majored in psychology, but I was very lucky. When I came out of college, was at the peak of, I would say, the women's movement. And being the peak of the women's movement is how I got a job at Chase Manhattan Bank, because the banks were expanding. It also was the end of the civil rights era. So if you look at the civil rights era, so there were two things. I was a woman, and then I was black. So those were the two things that kind of put my foot in the door and gave me the opportunity. Now, I'm not saying that anything was easy sailing. Obviously, it was long hours, hard work, but the point of view is that I was given opportunities that my parents had not been given, and I consider that to be very valuable.
Okay.
For where I am.
Very good. What did your parents do, and how did they mold and shape you?
Okay. Well, my mother was a nurse. My mother was one of, I guess in the 50s, one of the few nurses that actually went to Kings County Hospital. So she was she came out as a registered nurse, and I think there might have been 3 blacks in her class. So she also was
a trailblazer.
Yeah, a trailblazer. And my dad was a engineer with MTA. So he used to work nights because he was making sure that the tracks were put down and were safe. So that's what he did. So that was his career.
Okay,
yeah.
Very good, very good.
Yeah.
So you got into social justice, which we have a lot of material to go through, Roberta. So
Right.
I don't know if you want to launch in and tell us.
I'd like to share, share a little bit about social justice, but I'd like to share a little bit because I also want to reach out to people who are retired, as well as with this presentation is also for people who are working. Because when I worked, I never felt that I could ever do anything in social justice because it was always very demanding, come to this meeting or that meeting. But what I want to share is that there are things that you can do in social justice without actually going to meetings to have your voice heard. And that's what I'm hoping that people who are listening to this will take away and say, and not poo-poo, but really sign petitions, and consider those things. And if you do have the time, obviously come in and show up. But that's what I wanted to share. But the reason that I would like to go to this slide is to just highlight again so we can see some of the logos of who I'm working with. So when we hired the Union of Black Episcopalians New York chapter, being a cradle Episcopalian, that organization started in 1968, and its purpose basically is to make sure that people of African descent are fully embraced, well, not embraced, you can't control embracing, but fully engaged and know all of the opportunities that the Episcopal Church has to offer them. And then with the Episcopal Diocese of New York, by being active on social concerns, anti-racism is very important, and I particularly focus on the anti-racism workshops, which are a requirement of all the leaders in our church. We require that they take a workshop so that we're sure that they have an awareness and an understanding of what racism is. And we're hoping by doing that, and we're talking about the sin of racism, that they then will also realize that they can do something about that. And then finally, with Christ Church Riverdale, we decided we wanted to do something from a social justice ministry perspective. And when we did that, we realized that we could align with Northwest Bronx Community and Clergy Coalition, which has been around in the Bronx for over 50 years, this is our 50th anniversary. And we decided to become affiliate members because what they were doing aligned with what we believe that we should be doing as a church. So we felt that was to be church. And then my final activity in my retirement is that I started with a colleague we started the Black Presence in the Episcopal Diocese of New York project, and that project generates a website. And the website title there is called Black Presence Episcopal-New-York.org. But if you just put Black Presence in the Episcopal Diocese of New York, you will come to that website. So I just wanted to share that. So this is where I came from. And then what I really want to talk about, though, is how you and I met. We met because we were at the annual Bronx celebration of Dr. Martin Luther King's birthday, and that was at St. David's. St. David's is a church not too far from here in the South Bronx, where we're filming from, and St. David's has a history that a lot of people may not know. St. David's is the first independent Black Episcopal church in the Bronx. And the Reverend that started it, Reverend Clifton, started it because he realized that there was a community, and that was the Pullman porters, where a lot of them were staying in this area because at the end of, and around 1895, that's when they stayed here. So a lot of people don't know that, but that's the church. And of course, the reason I have more information about that, of course, that's on the website, the Black Presence in the Episcopal Diocese of New York. So we met because I was tabling. Now, when we use the term tabling is a term for organizing, that organizers use, and that's what Northwest Bronx Community Clergy does. We organize the community, and tabling is a way that you get the word out about your issues. So the first issue that I was addressing with when I met Patrick was I wanted people to comment and survey about some of the social concerns. So that is the Social Concerns Committee, wanted to know, how do people feel about the social concerns? How do they rank them? So we gave them 19 social concerns to choose from. And if you can see from here, from affordable housing to voting rights, we're talking about trans rights, all of these rights, and we said, choose the top 5. So we reached out. Now at that event, everyone was more in a celebratory mood, so we maybe only got about 20 folks.
Can you just quickly list the rights,
Roberta? I'll read all the rights for you.
Okay, yes.
Yep.
Please.
Certainly. So we were talking about affordable housing. We chose criminal justice reform. You could vote on domestic violence, environmental conservation, fair wages, minimum wages, green energy, hate crimes, healthcare affordability, higher education funding, immigration, LGBTQ rights, medical debt, police accountability, public safety, public school funding, racial justice, reproductive health care, trans rights, and voting rights. So that's covering pretty much issues that we feel society should care about. But we also know you can't do everything. So we wanted to know in this survey, what did you care about, and what do people want the church to do? So that was why we did the survey. Originally, I'm going to put out the results, but what happened at that event, Patrick, you know, everyone was enjoying good food. We had a nice DJ at the event, so we didn't get as many people to fill it out. So I decided to go to a couple of churches. So I went to, obviously, my church, Christ Church Riverdale, to fill it out. I went to Church of the Mediator, which is a bilingual church that's in Kingsbridge. And then I went to your church, Church of the Good Shepherd in Wakefield. So the results were, we got over 127 results. And of those results, the top ranking were 85% were worried about either affordable housing or fair wages and minimum wages. And you can see why I combined. I did combine the 19 into 11. So think about it. If you had more wages, then you wouldn't be worried about affordable housing. If housing was affordable, then you wouldn't be worrying about wages. So that's something that needs to be fixed. Then we had people that were worried about, the next ranking was healthcare affordability, medical debt, and reproductive health care. So if you think about that, they all go together. So if someone's concerned about that. And then the next ranking was public school funding and higher education. So education was very important. And then what tied for the top 5, public safety. But then also police accountability and criminal justice reform. So I'm just going to want everyone to think about these top 5 because this is important that we think about it. So we're talking about 85% for affordable housing or fair wages. 66% of the people felt health care and affordability. Public school funding was 53%, and 45% was both for public safety and also for police accountability. So when we think about that, I thought it was interesting that that's what the church had to say. At the same time, Northwest Bronx also had done a poll or a survey.
Roberta, can you just kind of define for me and the audience, what do you consider the Northwest Bronx?
Okay, so let me share with you. The name is called Northwest Bronx Community and Clergy Coalition because it started in 1974, and it was a group of community organizations in the Northwest area of the Bronx, which you would say is probably north of Fordham, just west. It includes west of the Hudson, east of the Hudson, excuse me, east of the Hudson. And I would say, I'm not sure how far west we go, because we go across the Grand Concourse. We go across the Grand Concourse. We're active across the Grand Concourse.
And how far north?
And above Bedford Park. You know, so fairly, you know. So
wide geographic area.
That's the original geographic area. Now, if you talked about the Northwest Bronx, and we're going to talk about that also, the fact that Northwest Bronx belongs to a Bronx-wide coalition. The type of activity that we do is Bronx-wide. So Northwest Bronx is very active Bronx-wide, and it's a name, you know, that we've had for 50 years that we've probably outgrown.
Okay.
That's what I would say for that.
Can you tell us a little bit about the coalition members? Who are some of the coalition members?
We're actually right near here, Hunts Point. There is The Point, or some of the coalition members. We have, the Northwest Bronx coalition members. Let me restate back. Besides Christ Church Riverdale, we have Manhattan College, we have Fordham. I'm trying to think of the other churches we have. We have All Angels, or the churches. So I'm just thinking, then we're associated with St. Tolentine. So I'm thinking, I told you Fordham and Manhattan College. I think that those are the main, when we're saying the coalition, besides the community. So that's what we're really saying. And I may have missed a few, but I think I've gotten everybody. On the coalition. And the reason I think it's good that you asked that question is because when we look at the social concerns rankings that Northwest Bronx did, they are very similar to the rankings that came from the 127 people in the church. As you see, safe, affordable housing is up there. We see that community safety is there. We see that jobs are very important. Quality education is important, health is important, and environmental and transportation. So, but their top 5 are pretty matching of our 5. So I think that that's very telling. And the reason that I am not surprised is that I want to share with everybody that we all are aware of our Bronx economics and Bronx's state rating, and this is why we need to work in the Bronx. That's why it's important that we work in the Bronx. So if you're looking at this chart here that I'm sharing with you, Bronx has the lowest median household income in New York City. Also, 26% of the people in this borough are living in poverty. And a third are spending more than 50% of their income on rent. So we all know why on both places housing has hit the top. The other issue at hand is, and I want you to remember this just to think about this, and you can think about it from healthcare. 1 in 4 Bronxites live and work in the Bronx. So that means of the jobs in the Bronx, only 45% of Bronx are Bronx residents. That means people are coming to these jobs from outside of the Bronx. 75,000 people commute into the Bronx that are
Daily.
from outside of New York City
Okay.
for work. But you know, we need to transpose this. People in the Bronx need jobs. So this is what's happening. So the point is that there are things that need to be done for that. We need to address that. But I think we should look at how Bronx ranks statewide. Bronx is ranks number one of the counties in New York State with the highest percentage of people living in poverty, and number two in absolute numbers of people living in poverty.
Even compared with Buffalo and some of these areas, Syracuse and...
As a percentage.
Yes, wow.
Brooklyn is number two.
Okay.
In absolute numbers, but not as a percentage.
Okay.
Bronx has the highest percentage of people. And remember, these are only the people that have been counted. And consistently, Bronx-wide health. We are number 62 in terms of health outcomes in the state. And there are only 62 counties, and we're number 62.
We're at the bottom. Okay.
We're at the bottom. So that's why the first thing I want to talk about is health, because all of these other things, if you don't have health, you can't do the jobs, you can't live. So I want to first talk about the importance of the health campaign and spend some energy talking about the health campaigns in New York.
Yes.
Okay. So if we look at our health system, it is totally convoluted with all of these lines with insurance on the top. And we know that health care should be on the top, not insurance. So one of the campaigns that New York Health is working for is for universal health care. We want universal health care because we want this to be streamlined. We also wanted people to know that this is not an issue that is just for the Bronx. This is an issue for most people in this country. So if we look at this, most people want a universal health care because this country is the only country of industrialized countries that doesn't have universal health care, or the government more engaged and that has health care as a profit perspective. Also, the higher cost of health care, but we get the worst outcomes, so it doesn't match. We're not matching on that. And that's
So we're spending, for the money we spend, we're getting less of return on it.
Exactly, which is
unsustainable too.
Right, and 73% of New Yorkers believe that health care is too high. And the reason I'm sharing this with you, because it's not a poor issue. It is not a black issue. This is an American issue. And we're spending $10,000 or more on health care. And I just think this is important to think about it. And 740,000 people are in debt, and 1 million people plus do not have health insurance. So this is New York State.
New York State, okay.
New York
Of
State.
1 million people do not have insurance.
Or if they have insurance, it doesn't cover what they should have.
Okay.
So why are we pushing for the Health Care Act is because what will it do for you?
And this Health Care Act, is it in the state of New York or
New
US-wide?
York Health. We want a New York Health Act. And New York as a state is as large as some companies. So we could do it. We can do the Health Care Act here, and they've done studies to prove it. And what it would do is it would get rid of monthly premiums, deductibles, co-pays, prescription drug costs, supplemental insurance, co-insurance, and what it would cover: dental, hearing, maternal care, long-term care, vision, mental health, reproductive care, and substance abuse for everybody. Because it's every New Yorker, everyone that works in New York would be qualified for this particular bill. So the question that people always think about is it viable? Can it happen? They have done studies. And the studies end up showing that we'd have a 4% savings. And where is the savings showing up? The savings shows up when you look at how much you are paying from private insurance or how much you pay yourself. When you quantify the shape, so that's on a chart, when you quantify the savings, we're looking at savings because we're going to kick out administrative costs. So this is the savings that comes through. This is how much is reduced, and most of these are administrative costs that are going to be
Roughly
reduced.
how much is that, Roberta?
That is $11.4 billion for
in
New
savings.
York State. Yes.
Okay. Which could go into education or housing or other areas.
Exactly.
Well, we're coming up against the time. We have about 2 minutes left.
Right. So what I wanted to do before
Sure.
we go through our 2 minutes is I have to push. I want to push everybody in terms of letting you know who to get in contact with, and if you wanted to hear about healthcare.
Sure.
So we have an organizer, and we're collecting postcards. We're promoting this program. We're promoting programs that end medical debt, which is a very important thing. We're trying to collect postcards, which is a way that you can get involved, because you would say that you're signing a postcard, and this is our organizer for health. And that's important for you to know that, and that we are out there tabling, and we are getting ready to do a resource fair where we will table and share a lot of information, and that's on March 25th. And that's at the location Mothers on the Move office. That's another organization that's very active, at 1158 Hamilton Place. And from 3 to 5.
Where is that? Where is that?
That's close to Hamilton Place is not too far from here.
Okay. Well, Roberta, that was a lot of information, and I'm sure you have more to share with us. So we want to thank you, but we want to ask you to come back and share with us additional information. We want to thank you also for coming to share with us your input and involvement in community activities, and we want to thank you wholeheartedly, Roberta, for sharing with us, and look forward to you appearing again.
Well,
thank you so much.
So glad to have been here. Thank you.
You're not going to get it all right. Just make sure you nail the big stuff, like making sure your kids are in the right seat for their age and size. Get it right at nhtsa.gov/the right seat.